and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, cancer, it's not prejudice. It strikes everyone. We've seen the racists with the big C. We've seen humanitarians struck down with the big C. But there are remedies, even if you've already had different measures of treatment, like prior chemo, surgery, or radiation that didn't work. Now, I'm telling you, there's a guy out there who is clearly the best at this. First tryout or second tryout, that's Dr. Gil Lederman. My personal experience in 1991 is he came up with a remedy for my dad. Others had passed on it or just couldn't figure it out. He was able to save my dad's life, and my family will always, always be grateful to him. But look, if you have newly diagnosed and recurrent cancers anywhere in the body, Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. This is Dr. Lederman, and taking your calls and talking about different things. The Veterans Affairs VA hospitals issued a report this week, and it was publicized in the Wall Street Journal here from Wednesday. And one of the patients called me up and said, why don't you talk about this? Why don't you talk about the fact that people have to wait a long time? Well, yeah. So the VA issued a report saying that there were no patient deaths at the Phoenix VA healthcare system directly caused, and I'm reading a report by Ben Kessling in the Wall Street Journal, directly caused by long wait times, in a final report that nevertheless detailed widespread scheduling problems there. He wrote, much of the attention of the agency was triggered by claims that the patients died because of long wait times that department employees didn't properly track. And there's a quote here saying, while the case review in this report document poor quality of care, we are unable to conclusively assert that the absence of timely quality medical care caused death of the veterans. The Inspector General. Okay, and they're talking about 226,000 veterans on wait lists. So it's a little bit hard to believe that if there's 226,000 veterans on wait lists, there was no adverse outcome. I mean, people going to the doctor, I think, want some care, unless getting care and not getting care is no different, and that would be pretty sad to say that we're spending billions of dollars in the VA system, and getting care and not getting care doesn't change anything. I mean, there must have been someone with heart disease. Didn't any one of those patients have a heart attack and die because they couldn't get to the doctor? Or cancer? I mean, if you wait 6 months to see a doctor, isn't that cancer going to grow and hurt the person? And that's why we offer appointments within one business day. We have something called the Urgent Cancer Consultants. We'll see you within 1 business day if you wish. I do have one patient I remember vividly who, from England, she had to wait 1.5 years to get surgery for a brain tumor, and it helped her. Why? Well, this is a woman, and she's a subject of a BBC documentary. She had one ear that was no good, so she couldn't hear out of one ear, and in the other ear she had an acoustic neuroma. She went to her doctors in Wales, in the United Kingdom, and they found the tumor, and they put her on the wait list for surgery. And they said, you're going to have surgery in 1.5 years. It takes 1.5 years to schedule you for surgery. But when we operate on you, we are going to take away your hearing. You are never going to hear again because one ear was sick. She had lost hearing as a child. One ear had decreased hearing from acoustic neuroma. And the BBC documented, they sent her to a sign language course, and the BBC documented the last time she was going to hear the ocean, the last time she was going to hear her children speak, and the last time she'd hear her husband speak, and the last time she would hear her friends, and the last time she'd hear her grandchildren. And really, it was heartbreaking to watch this video, except for the fact that I have many patients in United Kingdom, in England, Great Britain, and they invited me for a lecture, and she came to my lecture. This is about 12 years ago. She understood that if she came to us for treatment of acoustic neuroma, most likely she'd keep her hearing. So she was given this 1.5 year painful wait, but she used it, heard about and met me when I gave a lecture. I think it was in Manchester, England. And it's all documented. The BBC was following her around. They were following her around the last time she was going to church and hear a railroad train and everything. And then they documented when she met me. She then flew to New York, and the BBC came with her and documented the trip, documented the treatment. And now, more than 12 years later, I think it's 14 years, in fact, she is in remission, hearing, fully functional, and so she is one of the few people who benefited from this long wait by doing the right thing and coming to us for treatment rather than having surgery, which would have left her deaf in both ears. Wow. So sometimes strange things happen. We had another man this week with acoustic neuroma we treated. He had 5 treatments. He scheduled everything around a trip to Caribbean on a Disney cruise. So this is a man. He had his 5 treatments. I told him he's going to be fine. He finished the treatment one day. The next day he takes off on a Disney cruise, doing great. And he's the man who said, the treatment's like getting a little flashlight around your head. You don't feel a thing. Well, that's what we want to have happen. We don't want you to feel anything. And can you imagine if you had open surgery and someone opened your head and you're going to go on a Disney cruise the next day? It wouldn't happen in a million years. And that's the beauty of radiosurgery. It's highly effective, and in general, it keeps you with a good quality of life. And most likely, this man is going to be successfully treated. Most likely, he's going to keep his face. Most likely, he's going to keep his hearing, which is exactly the opposite from surgery, where most people are deaf and many people lose their facial function and can never function again normally. Many people never work, or actually many people lose their friends because of all the social problems of not having hearing in that ear and losing facial function. So wow, what a difference it makes what treatment you choose for your life. So if you have questions, if you have medical questions, you can call us anytime at 212-CHOICES. It's a medical hotline, 212-CHOICES, which is 212-246-4237, 212-246-4237. If you want the booklet and DVD about our work, you can also call us during the work week, Monday through Friday, 9 to 5. We will mail you a booklet and a DVD, and you can look at it and see what you think. There's 3 separate booklets. One is about brain tumors, one's about body cancers, one's about prostate. So just tell us which one that you want. Another man who came, interesting man, he's going to one of the biggest hospitals in New York. He has metastatic lung cancer. He has a big cancer in the mediastinum, going right up the neck. So in the right neck, he had a big ball of cancer. He was getting chemotherapy. It wasn't working as well as he wanted. He came to us. We treated those big balls of cancer in the neck and the mediastinum, which is the center of the chest between the two lungs. And then he got chemo also, I should tell you that. He got chemo before he came to us, and it wasn't working like he wanted. That's why he came to us, for his lung cancer, metastatic lung cancer. And then this was in the winter, last winter this year, and then he got a new PET scan, and they told him, oh, it's all messed up. It's all messed up on this PET scan. Well, that's not a very good answer. So we got the PET scan from the other hospital, and I spoke to the radiologist. I got it reviewed at another center, so I got a second opinion. And yeah, it's messed up because what we treated went away. Now, they got chemotherapy, so if you had chemo and it works, there should not be any new cancer in the body, right? So what we treated went away. We treated everything that he had. In the right neck, the mediastinum, it went away. They were treating the rest of the body. And now there's a new 4-centimeter mass that's PET scan positive in the right lung. And they said, oh, it's all messed up. Yeah, it's messed up because what we treated worked, and what they treated didn't work, and the cancer grew. And they can't man up and say, yeah, we didn't succeed. So I called up the radiologist, and the patient was present for the conversation, so he heard exactly what the radiologist said. And then I showed him the scans, so he saw exactly a new 4-centimeter mass of cancer, which was positive by CAT scan, positive by PET scan, that was not there before. If he had any doubts, he was offered a biopsy of it. We could watch it, we could treat it, we could biopsy it, whatever he wants. And then he remembered how nicely the other cancer went away with only 5 shots of radiosurgery. And he decided, Doc, I want to do the radiosurgery. I don't want to risk it. I don't want more chemo. I want to go. So he had a second opinion. He had a second opinion with us. He went back to his original chemo doctors. And we got 2 opinions from the radiologist about his PET scan. And he wants treatment. He likes the work we do, and that's the ultimate compliment, because for him and for many, many people, it worked. It gave him what he wanted. It gave him remission without complications. And I think that's what most people want, a remission without complications, without cutting, without bleeding, without surgery. This is Dr. Lederman, the Radiosurgery Hour, and we're talking about cancer. We're a cancer treatment center, and you're welcome if you wish to call us. You're welcome to come in if you wish. We treat cancer patients. If you have a big lump of something somewhere, we have many women with lumps in their breasts they've just been avoiding. Please come in. We can easily diagnose it without pain. We can stick a little needle in that you won't feel, suck out a few cells, stage you up. You'll know what you have in that mass, and you'll know where it is, and you'll have it probably within 1 day. So within a short period of time, instead of waiting home, you're not getting better if you got that lump of suspicious lump somewhere in the breast or the neck or somewhere. No, come in, let's get it diagnosed, and let's get some treatment going to try to get you in a better shape for tomorrow. This is Dr. Lederman. We're going to hear from a few new voices, and we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan.